Okay, I want to introduce James Hastings. He is here from Ireland. He is a father of 3 boys and a patient with cholangiocarcinoma. He received his diagnosis in his home country and was offered little to no hope by his doctor. Not willing to give up, his community rallied around him and helped him get the treatment he needed, and he is here today to share more about his experience. 2 days ago, he had never met anyone else with cholangiocarcinoma diagnosis, and now he is surrounded by others who understand his journey. We are so fortunate to have James here and are eager to hear more about the advocacy that saved his life. James.
Hi everyone, my name is James Hastings. I'm 41, married to my high school sweetheart Marion, and we have 3 amazing boys who are 13, 10 and 5. I'm from Kinvara, a colourful fishing village on Ireland's west coast. I ran a busy tyre centre just outside the village. I'm really passionate about supporting startups and other small businesses that are breathing life into rural settings. Today I'm here to tell you about my story so far with cholangiocarcinoma, which started in 2023. Please excuse me for reading these pages. My experience is very recent, and writing it down brought up a lot of mixed emotions. I think my story is one of hope, though. Last year started out great. I felt in good health, enjoying sports, and my business was doing well. We were on track to start some home improvements and had great plans for the year. In late May, my wife and I noticed the whites of my eyes and my skin were a bit yellow. I had some discomfort in my side. The GP told me I should go to the hospital to get it checked out. That was Friday, the 26th of May, or the day we strapped into the roller coaster, so to speak. An ultrasound and a blood test showed my bilirubin levels were too high. I was admitted. When a CT scan and a scope showed my bile duct was blocked, I was told it could be an infection, a virus, or something more sinister. I needed a stent. They never mentioned the word biopsy, but that was done too. The ERCP for placing the stent came with a small risk of developing pancreatitis, which I unfortunately got. On the 9th of June, the gastro consultant broke the news I most probably had cancer. It was a massive shock. My wife nearly passed out. They couldn't find the source, so more tests were needed. After many more tests, I met with the oncologist and his clinical nurse for the formal diagnosis. I could tell from their expression the news was serious. The cancer was in multiple locations. It had spread via the lymph nodes to areas around the pancreas, lung, and neck. I was told it was stage 4. It was a massive shock to both of us, from fighting fit to staring down the barrel of a gun. The appointment was my first introduction to the word cholangiocarcinoma, the first time I'd heard of CCA, and the outlook was bleak. The doctor said life-extending palliative chemotherapy was the only option. I asked him whether I should live this summer with my kids like it was my last. The answer was a clear and somber yes. Now I'm naturally optimistic. I have done a fire walk. I'm a big believer in mind over matter. I told the doctor I'd do whatever it took to beat the cancer. I said I would go anywhere, do anything for treatment. He said he might be able to help me get onto an appropriate clinical trial if I could find one. The only shred of hope was a test called Foundation 1 molecular profiling. There was a slim chance my cancer could be MSI high and therefore responsive to immunotherapy. In Ireland, you have to pay for the test privately, and it takes 2 weeks to come back. I asked them to start the process immediately. In the meantime, the doctor would apply for the 2 immunotherapy drugs, pembrolizumab and durvalumab, on compassionate grounds to potentially extend the time I had left. We walked out of the hospital that day in a daze. We had to tell our boys the news before they overheard it on a sports field or at school. Kinvara is a lovely place. Everyone knows everyone, but rumours can snowball. We were relieved that they heard it from us first. We told them the doctors would try to do everything they could, but we didn't know how it would work out. It was a gut-wrenching conversation, and we felt like we were taking some of their innocence. The next day, I made sure Marion and the boys would be financially okay if the worst happened. What a reality check. It was the kids' last week of school before the summer break, so I cycled with them to school and spent as much time as I could playing with them, thinking each precious moment could be a last time for me. At work, my wonderful friend and employee Danny stepped up to take over the business. In Ireland, self-employed people can't access sick pay from the state, so without an income and with a mortgage and a family to feed, I asked the local government minister for help. He was brilliant and did everything he could to ease my stress. While that was an incredible relief, I couldn't have foreseen what was to come. Our journey took a series of twists and turns. The oncologist rang me with the best news. Initial testing showed my cancer is MSI high and should respond to immunotherapy. I wanted to start the chemo and immunotherapy as soon as I could, but then my appeal for immunotherapy on compassionate grounds was refused. The drugs aren't approved for the reimbursement scheme in Ireland for cholangiocarcinoma patients, although they have been in the EU since December 2022 following Topaz 1. Ireland just has not caught up yet. The National Centre for Pharmacoeconomics dictates what drugs are available and when. They could be purchased privately at a cost of about €10,000 per dose. For a chance to access and buy the medication then, we knew we would have to cause a stir and go public. We bought a website domain, jamesfightsback.ie, and spent hours setting up a site to explain the story so far and ask for help, and social media pages to go with it. The unplanned admin took its toll. How unfair to be spending our precious time together working on laptops and phone calls from 6 a.m. daily while trying to keep life as normal as we could for our children. We assembled a team of 10 and met around our kitchen table to talk about fundraising and worked out that we'd need about €250,000 to cover travel costs as well as medications. Marion's friend Carissa is in PR, and she set up a GoFundMe campaign and wrote a press release, which then followed with national TV, radio, digital coverage of my story with the headline, "What Price on a Life?" We were overwhelmed by the support and kindness of friends and strangers and made us feel so supported as a family. We were beyond grateful that in just under 3 weeks, we exceeded our fundraising goal with over €300,000 raised for my treatment. Now we were ready to go places. Then it was time to begin chemotherapy. I should have had the immunotherapy with the chemo, but after 2 sessions, the public hospital told me they could not let me pay for the drugs privately because another patient might not be able to afford to pay for the same thing. This makes no sense because private patients are treated in public hospitals every day in Ireland. We made an appeal to the Minister for Health and even to the Taoiseach, the Prime Minister of Ireland, who used to be a GP himself, but they chose not to intervene because they didn't want to be seen bending the rules for just one person. A chink of light appeared in the form of Professor John Bridgewater, who is based at University College London Hospital. He is recognised as one of the top CCA experts in Europe. After reviewing my case, he said everything would depend on the MSI marker. Waiting for the Foundation 1 results was like being on a cliff edge. Every moment mattered, and we couldn't wait for the results to come back. But believe it or not, it turned out the test had been delayed for 4 weeks because the doctor's office didn't have the right shipping boxes to send it off. That equates to a 2-year delay for someone living to a normal life expectancy compared to mine at that time. When the results did eventually come back, the news was golden. Professor Bridgewater confirmed I was MSI high. I'm only the 4th patient he's seen in the circumstances with a CCA diagnosis. He agreed then and there to treat me, recommending 2 drugs, ipilimumab and nivolumab, as the premier treatment for my cancer. I would have an infusion every 4 weeks in London for 2 years, after which he said I would be as cancer-free as anyone else. He also said I could stop chemo straight away. Finally, some amazing news. Our heads were spinning in the right way. It was just as well, because the scan in London showed the cancer had already spread to a new area of my liver. My first infusion was on the 8th of August, and it went well, but the treatment wasn't without its ups and downs. Just after the first one, I ended up in hospital for over a week with a temperature and high CRP levels. Professor Bridgewater was confident I was having a reaction to the high dose of IPI, so he said he would reduce it for the next one. For the next treatment, I arranged to stay a few days longer in London in case I had another reaction, but this time I caught COVID. Since then, the treatments have mostly gone to plan. I have thyroid issues. It was hyper, it was then hypo, and then other endocrine-related symptoms. Who knows what the next blood test will bring? The routine now is nivolumab every 4 weeks and scans every 12 weeks. I get scan anxiety waiting for the results with my next scan next week. October's scan showed the tumor had shrank. The lymph nodes were nearly all back to normal size. It shows the treatment is working. The following scan was also positive, and Professor Bridgewater now describes me as a complete responder. Naturally, I'm over the moon with my progress and for Professor Bridgewater and his amazing team in London. But I'm also incredibly frustrated by a healthcare system that let me down and every other cancer patient that has found themselves in the same situation. In Ireland, we are brought up believing if something goes seriously wrong, the public health service will look after you. That's just not the case. There is so much red tape and bureaucracy and zero accountability. Worse still, staff are stretched so thin that patients like us are left to try and figure it out for ourselves. Take my experience in the public hospital, for example. My first admission was during a heat wave in a ward of 6 people with no air conditioning, and the windows were all sealed shut. There was one toilet cleaned once a day and not at all on Sundays or public holidays. Silverfish scurried across the floor at night while patients were left to empty their own stoma bags just days post-op. The nurse simply told me, make a formal complaint. On another occasion, the first day of my chemo treatment, we arrived early, was told there was no bed. We were briefed in a tiny patient's canteen, a room with a fridge, a microwave, basket of loose tea bags, and sugar on the windowsill. The nurse explained she needed to nasal swab me for MRSA and that I could do the anal one. There was no bathroom available, so she suggested I do it right there and then in the canteen, just as another lady walked in to microwave her porridge. I said I'd wait for the bathroom to become available, thank you. I tried to make light of it, but the lack of attention to hygiene is actually quite horrifying. There were other experiences where I felt really let down too. For example, I had a follow-up oncology appointment booked in Ireland, but they were cancelled and never rescheduled. It made me feel like just a number. I could have been their success story, but I felt like they didn't care. The reality is, I wouldn't be here now if I'd gone along with their palliative treatment plans. In October, my best man died of cancer. It should have been treatable, but everything went against him, and he didn't make it. It was so sad saying goodbye to him. I felt so guilty for being the one who survived. It really brought home how lucky I am to be here today. I'm going to do my best to make him proud. My advice for people with this cancer, or any, is self-advocate all the way. The only silly question is the one you don't ask. Get that second, third, and fourth opinion until you feel like you're in the right hands. For me, telling my story, my story, has made my journey, although I recognize, for me, telling my story has made my journey easier, although I recognize everyone is different and there is no right or wrong. I'd like to say a big thank you to the Cholangiocarcinoma Foundation, and thanks to all the great doctors, nurses, researchers, advocates, caregivers, and patients around the world shouting to make our lives as patients better. I'm an open book. Please reach out to me if there's anything I can do. Thank you.